name is JC. I'll be your nurse for today.
Okay.
Before I start, can you just tell me your name and date of birth, please? I'm just going to check it.
Rachel Keegan, March 9th, 1994.
Okay, thank you. Before I start, I'm just going to wash my hands real quick.
Okay.
Okay, I'm just going to pull the curtain. I'm going to give you some privacy.
Okay.
Just gonna use. Okay. I read up on your chart and it says that you've been experiencing belly pain. Is that what brought you in today?
Yeah, my doctor diagnosed me with peptic ulcer disease after the results came back from my endoscopy that I had done yesterday.
How long has this been occurring? Is this pain relieved by antacids?
It's been about 2 weeks, and I take Tums for the pain, but it only relieves the pain for a short time.
Do you have any other symptoms?
I wake up at night.
So you have peptic ulcer disease, which causes painful sores or ulcers in the lining of the stomach, or part of the small intestine called the duodenum.
Sorry, I just got a text.
It's okay.
That was my sister. She's on her way here to see me. So what do I do about the peptic ulcer disease?
Well, it's good you came in. We can help you.
Oh, hey.
Hey Rachie, how you feeling?
I'm feeling okay.
Good.
Hello, my name is JC. I'm Rachel's nurse. I was just talking to Rachel about her condition. Rachel, are you okay with your sister being here, or do you want your privacy?
No, she can stay.
Okay.
Ew.
So, peptic ulcer can be caused by many things, including H. pylori, which is a bacteria. So we can see what works for you. Your doctor ordered Flagyl to treat your ulcers.
What will that do?
Flagyl is an anti-infective as well as an anti-ulcer agent. It is used to kill off H. pylori, which is the bacteria that's causing you trouble. It does this by interrupting the DNA and protein synthesis of the bacteria, which kills and stops the spread of the bacteria.
Will that make the pain go away?
The pain you're experiencing is caused by the ulcer and is aggravated by the stomach acid coming in contact with it. Flagyl is usually given with combination with another antibiotic, such as tetracycline or amoxicillin, a proton inhibitor, and bismuth compound over 2 weeks, which would help reduce the stomach acid, which will lessen the pain you're experiencing. So yes.
So I have to take 2 antibiotics, a bismuth compound, and a proton inhibitor? Why do I have to take all these drugs?
This is a combination of drugs known as a quadruple therapy. It's shown to be effective in treating peptic ulcer disease. Flagyl is used to kill off the bacteria, and a second antibiotic is needed to reduce the bacteria's resistance, because as you take antibiotics, the bacteria could become resistant. So this would make it more effective. Okay, Pepto-Bismol is used to relieve discomfort as it acts as an antacid and an anti-inflammatory agent to relieve your gastrointestinal discomfort. Proton pump inhibitors are given to inhibit active proton pump inhibitors, which in turn would decrease acid secretion. The doctor has ordered for you to take 500 milligrams of Flagyl twice a day, once in the morning and once in the evening.
So are there any adverse reactions or side effects I should be aware of?
I was just about to get to that. Yes, there are some you should know of. Flagyl can cause some serious life-threatening adverse reactions, such as seizures, Stevens-Johnson syndrome, a rare disorder. It starts off with flu-like symptoms and progresses to a painful rash that can spread and blisters that would cause peeling of the skin. You should report any of these immediately to either me or any of your healthcare providers. Other side effects include unexpected metallic taste, dry mouth, dizziness, and glossitis, which is a furry tongue. You should also avoid activities that require alertness, such as operating heavy machinery or driving while taking this drug.
So if I have a rash or feel dizzy, I should come back?
Yes, you should call your healthcare provider immediately. Hello.
Hello.
Hi.
How you doing? My name is Amrit, and I'm the nutritionist here. Can you confirm your name and date of birth?
Rachel Keegan, March 9th, 1994.
All right, perfect. All right, thanks. As part of your drug treatment for peptic ulcer disease, you'll be taking Flagyl. This medication is typically taken orally. You can take it either on an empty stomach or to prevent GI discomfort with food and water. Tablets can be crushed if you have any difficulty swallowing right now, and if the tablet is imprinted with ER, that indicates that it's extended release, so you can't chew that type of tablet or you can crush it. As far as dieting goes, you'll be on a Pepsia diet, which basically means to avoid foods that may irritate your GI system. One way to identify these triggers that worsen your abdominal pain is keeping a food journal. After a food journal has been completed, notice correlations between food consumption and the symptoms you experience related to gastric discomfort. Some foods associated with gastric discomfort are coffee, alcohol, black pepper, red or hot peppers, chili, powder, cocoa, chocolate, cola beverages, coffee, citrus fruits and juices, strong spices, fatty and fried foods. These should all be limited, if not entirely cut from your diet. I printed out a list of these to make it easier for you to identify which foods trigger these gastric responses. So here you go. Take a look at those.
Wow, that's a lot of stuff. I guess I'm gonna have to start watching what I eat.
Indeed, this is a lifestyle change. However, there are still many tasteful options for you to choose from. You can eat a variety of healthy foods from all the food groups, such as fresh fruits, vegetables, whole grains, fat for your low-fat dairy foods. Whole grains include whole wheat, breads, cereals, pastas, brown rice. You can also choose from lean meats and poultry, such as chicken or turkey, fish, beans, eggs, and nuts. A healthy meal plan is that which is low in unhealthy fats, salt, and added sugar. That's also indicated on the paper I just gave you. A few immediate actions that you're going to need to take note of right away is you need to refrain from alcohol intake during and 3 days after treatment with metronidazole, which is also known as Flagyl. That's because you may encounter a disulfiram reaction, which causes flushing, nausea, vomiting, headache, and abdominal cramps. Basically, these symptoms are really bad when interacted with alcohol. You need to also avoid caffeinated beverages such as coffee or energy drinks. This is because they stimulate acid secretion in your stomach, and that will lead to intensified pain with your ulcer. Smoking cessation and stress reduction are also recommended because they alleviate excess acid secretion. They won't prolong wound healing, so you want to get out of here as soon as possible. Increasing probiotic intake will help relieve your abdominal pain related to GI inflammation. Eating foods such as yogurt and kefir will help to relieve that discomfort. Chewing food slowly and thoroughly will help aid in digestion, and eating small frequent meals throughout the day is a better option, and it's better tolerated to your stomach as opposed to a large meal.
So all this will prevent me from feeling pain. What about at night when I don't eat? Why do I feel pain then?
That's a good question. If you avoid eating 2 hours before bed each night, this will prevent you from waking up due to pain at night. That's because the digestion process takes from 1 to 2 hours to reach your duodenum where the ulcer is formed. That's the reason that you're suffering pain. By managing the time that you eat, you shouldn't expect to experience any abdominal pain and waking up an hour into falling asleep. So if you just refrain 2 hours from eating before bedtimes, you won't experience any pain while falling asleep. Do you have any other questions?
Nope, you answered everything. Thanks.
All right. It was very nice meeting you.
Oh my god, Rachie, that means we can't have our caramel macchiatos from Starbucks anymore. We can't have coffee because you can't drink it anymore.
I need my caffeine though.
And that also means that your partying days are over because we can't have Red Bull and vodkas.
It's my favorite.
Rachel, I know you're young and you want to have fun, but you really have to limit your alcohol consumption as well as your caffeine. These can worsen your condition, which can be changed by lifestyle changes. Moderation is key in this change. I know it's a lot to take in.
Yeah, I'll try to do my best.
Okay, do you have any questions before I prepare to give you your medication?
No, I think you did a good job explaining it to me.
Okay, I'll be with you in a moment. Let me just prepare your medications.
Okay.
Date of birth is March 9th, 1994. The order is for Flagyl, 500 milligrams. Last given at 6 o'clock. Next medication is supposed to be given at 6 p.m. PO. Okay. This is 500 milligrams of Flagyl. It's a tablet. Okay. Okay, I have your medication. Let me just wash my hands real quick. Okay. So I have 500 milligrams of Flagyl for you.
Okay.
Can you just confirm your date, name, and date of birth?
Rachel Keegan, March 9th, 1994.
Okay. Okay. Would you like a cup of water?
Sure.
Okay, I might need you to swallow this.
Okay.
Rachel Keegan, 500 milligrams of Flagyl at 6 p.m. And it was the right medication.